This is the scene that I saw in Singapore. When it comes to neck and shoulder pain, everyone thinks that acupuncture, cupping, massage, or taking herbal powder is the only way to get results. The stereotype is that, if your neck hurts, you must go for a massage, but that is wrong. I believe most of you have already tried all the treatments on the market, whether it is cupping, massage, acupuncture, medication, or some special pillows, or even some ointments, some king of medicines, very good ointments applied on the skin. Why do we get cervical spondylosis? The first reason is osteoporosis, which happens as people get older. As calcium is lost with age, the joints will slowly compress, and the head will tend to tilt forward, which will then stretch our cervical nerves. The second type is occupational disease. What you cannot avoid at work is sticking your head forward, like this, sticking it forward. Whether you are a student or a white-collar worker, we all look at computer screens. The font is small, so our heads will lean forward to see, and this will cause our cervical spine to be pulled. When our cervical spine tilts forward, the front joints get compressed while the back stretches. The back is packed with nerves and muscles, which we call fascia. When buying pork or ribs, you will notice a white film, that's fascia, the muscle's connective tissue. It links muscles to joints. When compressed, fascia pulls, causing muscle tension. Like clenching a fist, this tension restricts blood flow, leading to soreness. Why? When muscles lack oxygen for too long, they tighten up. It's like carrying a heavy school bag or a stone all day long. That's the feeling of cervical spondylosis. The second type is occupational disease, including lorry drivers, long-distance drivers, or many hawkers. When hawkers are cooking, their heads also have to look down. Of course, nothing much will happen in just 1 or 2 months. If it's been 4, 5, 6, or 7 years, it'll definitely be sore. Go to any TCM practitioner, they'll just say, "Oh, it's frozen shoulder," or "you have bone spurs." No, they just keep saying it's frozen shoulder. They tell you to sleep with stacked pillows and just apply this ointment because of that diagnosis. Muscle soreness is caused by the displacement of our cervical spine, long-term pulling of the cervical spine, and muscle tension. The third type is when many people go home, feeling very tired from work or studies, and they like to put a small pillow here. They like to lean their heads back while playing with their phones, watching TV, or playing with their phones. The head is propped up for a long time, causing your cervical spine to become straight. At first, nothing seems wrong, but if you do this for a long time, like 1 or 2 months, you will definitely have neck and shoulder pain. Even primary school students can get cervical spondylosis because they are not made of iron either. Straight necks will ache. Pillows are daily items, not medical devices. They can't fix your spine. As long as your cervical spine is displaced or straight, you will be in pain every day. It is impossible for your bones to bend back on their own just by applying ointment or taking herbal powder. That is simply impossible. Some people also sleep with 2 pillows. Why is this a problem? As mentioned, our cervical spine has a natural curve. Your cervical spine, from C1 to C7, has a natural curve. Stacking 2 pillows might help you breathe, but it pushes your neck out of alignment. If your pillow stays too high for too long, it forces your spine forward, leading to neck pain. Once your neck is misaligned, no ergonomic pillow can help. It's too late, you can't just crack it back into place. You can ask anyone around you with neck issues or chronic pain. Ask them, after going to some master to get it cracked, is it actually cured? Is it really gone? Not only is it not cured, but now their fingers are numb too. Why does it always feel looser immediately after getting it cracked? Because when bone hits bone, that area becomes congested. It'll pump blood to that spot. Like I said, your muscle pain is from muscle strain and tension, so the blood flows slowly. Just like this, blood flows slowly. So when you crack it, blood pumps there, and the oxygen-deprived muscles temporarily get some oxygenated blood. It's like a sudden drizzle during a drought. Wow, so refreshing. Thank you, master. Thank you. But once you go home and shower, it tightens up again. Why does this happen? Because the oxygenated blood is used up within 4 to 8 hours, and your neck is still misaligned. It has no curve, the joints are tilted forward. So with constant strain, your muscles stay tense, leading to oxygen deprivation and pain again. Then after a few days, you go back to those masters again. Ayo, master, I'm in pain again. Usually, over 1,000 customers here tell me the same thing. They'll tell me, "Oh, you need to come often, because one visit won't fix it. You must come many times, let me crack it every day, so I can slowly correct it and crack it back for you. No, it won't just crack back into place. That crack you hear is just the sound of bones hitting each other. It's like a boxer cracking his knuckles. Crack, crack. After cracking, the fingers feel stiff, blood rushes in, and the joints become very stimulated. It's the same. When this area lacks oxygen and you twist it, blood pumps there, giving you temporary relief. But if you keep cracking it over and over, the bones keep hitting each other. Your immune system will automatically try to repair it with calcium and protein, repairing it again and again. It gets thicker and thicker until it hits the nearby nerves. Once it's thick enough to press on those nerves, your fingers go numb, especially when you're sleeping at night. When bones collide, the area starts to repair itself. It repairs layer after layer, getting thicker and thicker until it becomes a bone spur. People here love using a gua sha board to scrape, thinking it'll improve circulation. When you scrape, your immune system thinks the area is injured and tries to fix it. You feel temporary relief because the oxygen-deprived muscles suddenly get blood, but there will be side effects, especially with the occipital bone and gua sha. Many women love scraping this area. After all that scraping, extra tissue grows because your immune system wants to reduce friction and protect the joint. Eventually, it becomes a dowager's hump. Acupuncture is good, but it only treats the symptoms, not the root cause. Because once your neck is misaligned, acupuncture cannot realign your bones. It's impossible for you to straighten your spine back to normal. It's like if you dislocate your ankle playing badminton or basketball. If it's out of place and you don't reset it, but instead use acupuncture, medicated plasters, or strong medicine, do you really think a dislocated joint will just fix itself? I'm sure everyone knows, even a primary school kid could answer this, it's impossible. Every day you don't correct it, your joints will stay inflamed. If you don't fix it, you'll be in pain every single day. Can this be cured for good? If it's serious, there's no choice. Chronic neck pain and numbness can lead to stroke. If you don't get it treated in time, your life could really be at risk. The first way to cure it is surgery. They'll put in metal plates and screws to stop your joints from compressing. Because when your joints compress, the nerves will pull on your muscle tissues. But the most dangerous part about surgery is that there are so many nerves in the neck. The risk is very high, and even if the surgery is successful, you can't afford any accidents. If you fall in the toilet or something, twisting your joints would be very dangerous. The second method is physiotherapy. Physiotherapy isn't cupping, it's not acupuncture, it's not massage, and it's not applying ointment. A lot of people misunderstand what physiotherapy is. You can go to big hospitals, like private ones in Malaysia or the General Hospital, or even polyclinics in Singapore. They have a physiotherapy room where they use a rope to help you stretch. This can actually cure it, but it just takes a very long time. Meaning, if you go for stretching once a week, you'll need to do it for 1, 2, or even 3 years. Because it's impossible for your bones to just recover forever after only 2 or 3 sessions of physiotherapy. With physiotherapy, you need at least 30, 40, or 50 sessions to see improvement. It stretches your spine back to its original curve so your joints don't compress. Going to the hospital is quite troublesome, and the cost is also higher. The most annoying part is the hassle, because you have to go every week. You can't just go for 6 months and then stop for 2 months, or all your previous effort will be wasted. Zhu bao. This Zhu bao is not a pillow, it's not meant for sleeping. I suggest you follow the timing I gave you for stretching. You really cannot use it for sleeping. Comparing stretching at the hospital every day versus stretching at home every day, is daily stretching more effective or going once a week? Surely daily stretching is more effective, right? Plus, stretching at home twice a day, morning and night, is so convenient. You don't need to book any appointments, and most importantly, you don't have to pay every day. You won't need to keep going for bone setting or sign up for 20 or 30 session physiotherapy packages just to get a better deal. You can skip all of that. Just one of these will cure it for good. Because this is actually very scientific. When your neck gets too straight, you need a device to stretch it back. For example, with these 7 joints, you stretch your neck daily like this. Your head's weight stretches the C1 joint. Your body presses on the T2, pushing joints 1 to 8 upwards to restore the curve. The first time you get up, it'll snap back straight. Same thing the second time. By your 20th session, your neck will start to regain its proper curve. Previously compressed and strained, the joints will open up, improving blood flow. As blood flows, your muscles relax. Hope this helps you understand. If you want more detailed information, you can contact me at the WhatsApp number below.